Good morning, everyone. Thank you for joining us today. We are excited to present our group research project titled Integrating Occupational Therapy and Mindfulness Practices in Chronic Pain Management, a case study analysis. My name is Tanisha Anderson, and I'm here with my colleagues, Nissrin and Alex. Our faculty advisor for this project is Professor Richard Sabel, and our course instructor is Dr. Crystal Burrington. So over the next few slides, we will walk you through the purpose of our project, our guiding research question, the literature that informed our approach, and our proposed interventions for chronic pain management using occupational therapy and mindfulness. So let's start with the introduction. For healthcare professionals, pain is one of the first and most frequent concerns clients report. Chronic pain is defined by the CDC as pain lasting more than 3 months, and it can have a profound impact on a person's life. Over 50 million people in the US are living with chronic pain, and about 18 million of them face significant limitations in daily activities due to the intensity of their pain. Chronic pain does not just affect someone physically, it can also lead to mental health challenges like memory loss, substance abuse, and even increased suicide risk. The challenge with chronic pain is that it's not always visible, making it harder to assess. It could be classified as acute or chronic and either primary or secondary. Traditionally, healthcare professionals lean heavily on pharmacological approaches to manage pain. While medications are helpful, they often bring side effects that can interfere with the quality of life. That's why there's been a shift towards a more holistic biopsychosocial approach. This model addresses not only the physical symptoms, but also cognitive, emotional, behavioral, and social aspects of pain. It's been shown to be more effective in helping people reclaim their ability to function and to engage in everyday life. Occupational therapy offers unique holistic methods for chronic pain management by focusing on meaningful activities and lifestyle changes. Studies like Reveal OT and Lifestyle Redesign show that OT improve performance, satisfaction, and confidence in daily activities. OT also supports mental well-being by increasing feelings of dignity and energy. Techniques like cognitive behavioral therapy, energy conservation, and stress management are widely used in practice. OT interventions often include complementary strategies that align with the biopsychosocial model. Mindfulness and slow breathing techniques have been shown to reduce pain perception and improve mood. Yoga and Tai Chi supports physical function and stress relief, while the Feldenkrais method enhances movement and awareness. Cognitive behavioral therapy is also integrated into OT programs to address mental health and promote long-term outcomes. So this brings us to our research question. Does occupational therapy practice, along with mindfulness, provide management of pain and improve occupational performance in adults with chronic pain? Our research questions explores whether combining occupational therapy practices with mindfulness techniques can help manage chronic pain and improve occupational performance in adults. Given OT's focus on holistic care and meaningful activities, along with mindfulness, proven benefits in reducing stress and pain perception, we wanted to investigate how these approaches work together, and this question guided our review of current literature and interventions used in practice.
Our study was an 8-week virtual therapy exercise program that we did via Zoom with one participant that we recruited from the Mount Sinai Hospital. And this patient reported to us that she had a lot of pain for a very long time. During our sessions, we did a lot of physical exercises with a participant, including exercises that were focusing on mindfulness practices exercises such as Tai Chi, yoga, breathing exercises, and body awareness exercises. In order for us to know if our program was successful, we did before and after assessments. So before we started this program, we did an informal interview with the participant where she claimed that because of her chronic pain, she wasn't able to go outside and walk. She wasn't able to go to the store. She wasn't able to sleep at night. She couldn't have a good night's sleep. She couldn't cook. And she also shared with us that her marriage was on the rocks. She said that her husband, because of her condition, living in chronic pain, that he wasn't very supportive and understanding of her, and she even mentioned there were incidents where they were discussing about having a divorce. After the program was over, we reached to her to do a follow-up, which was our after assessment, and here's what we found. The results showed that she reported improvements in sleep and enjoyment of life. She reported an increase in both performance and satisfaction in exercise and cooking. During the interview, after the program was over, she made some statements. She said that she had increased confidence to move and engage in activities, and she shared, quote, "I can do things, and that's big for me," quote. She experienced greater body awareness, stating that she learned how to assess her body to better manage her pain. She emphasized during the interview how the program gave her hope and a new perspective on her capabilities. At the end of the interview, she shared with us that her communication with her husband has been improved. She said now that her husband saw her being more active, being able to go outside for a walk, being able to dress herself and go outside, being able to cook and have a better quality of life, he started becoming more understanding and supporting of her. And she even shared with us that now they're doing exercises together as a couple. And she said because of that, she felt deep inside of her that her marriage got stronger.
So now on to the discussion. Our chronic pain program showed that participants can experience meaningful improvements in mental health, daily engagement, and social connections. Our participant reported increased confidence to engage in activities like exercise and cooking, greater optimism, and emotional resilience when facing daily challenges, positive changes in relationships, notably with her spouse, enhancing shared activities and emotional connection. Mindfulness practices, including breathing techniques and body awareness, were key in shifting the participants' perception of pain and boosting participation. These outcomes align with the findings from the studies in our literature review, which showed occupational therapy interventions improve emotional resilience and daily functioning despite persistent pain. Overall, this project highlights the critical role of occupational therapy in managing chronic pain, focusing not only on reducing physical symptoms, but also promoting life engagement and emotional well-being through a holistic biopsychosocial approach. So as for our limitations, our study was limited by a small sample size, with only one participant completing the entire program, which restricts the strength of our conclusions that we can draw. Selection bias may have also been a factor, as participants needed access to technology, which was the Zoom, and English proficiency, potentially excluding those from different socioeconomic or cultural backgrounds. The short study timeline limited the ability to observe gradual or delayed effects from the interventions. Reliance on subjective or self-reported data may have influenced the accuracy of our results, as no external clinical assessments were used. So these limitations highlight the areas for improvement in study design, but also demonstrate important preliminary findings for future development. So in conclusion, this case study highlights the effectiveness of occupational therapy and mindfulness-based program in helping manage chronic pain through a biopsychosocial approach. The participant showed meaningful improvements in confidence, daily engagement, emotional well-being, body awareness, self-management skills. She also reported stronger coping strategies, better communication with loved ones, and greater hope for long-term wellness. Mindfulness techniques, breathing exercises, and body awareness activities played a key role in helping her re-engage in meaningful daily activities and improve her quality of life. These results support the value of a holistic occupational therapy approach that addresses the physical, emotional, and social aspects of chronic pain management. So as for our future directions, larger studies with more diverse participants are needed to confirm these findings. Longer program durations could help measure lasting improvements, and using objective tools like activity trackers or clinical assessments could strengthen further research. And these are our references.
Any questions? Okay. Well, I want to say thank you to those who attended to this MP Day. Thank you to our faculty advisor, Professor Richard Sabel, Dr. Krista Brewenson, Carpus Health Information Center at Mount Sinai, our participant, and Downstate OT program. Thank you.